My first question of the debate will be for Austin. Republicans against the Affordable Care Act, like Carlos, claim it to be hugely expensive, say it will cause healthcare costs to go up, and want Medicare created into a voucher system, breaking it up amongst private and public options and letting competition work its will. What do you have to say in response to such claims, and how do you think the Affordable Care Act will solve the nation's healthcare issues better than a Medicare voucher system or the old system that we had in place?
My issue with the Medicare voucher system is that it takes a bunch of people who are on Medicare, which is largely a very relatively a successful and stable institution, and moves them into the private insurance market. And that private insurance market, those pools of people will skew more older and more sick, which will drive the costs up for the people in private insurance, as well as those people in Medicare will now have a smaller pool of people on their own, and so their costs will go up as well. I believe the Affordable Care Act will address these claims because it requires people get covered, and when people are covered, then the uninsured aren't going to the emergency room, and then we're not footing the bill for them. The other issue I have with Congressman Ryan's plan is that it doesn't provide for the uninsured to get covered other than changing Medicare into a voucher system. What do you do for the people who weren't eligible for Medicare anyway? He also takes all the savings that Obamacare creates in his budget, but doesn't keep any of the reforms. You can't have the savings without the reforms.
Carlos, your rebuttal?
Definitely. Well, we definitely recognize that there has been a breakdown of our healthcare system, people not being covered even before Obamacare even came into place. But the problem is that we're not addressing those issues. Those solutions that we sought in Obamacare are not there. In fact, they're doing the exact opposite, affecting the people that it was meant to help by, again, dropping coverage and work hours. But like any other welfare or any program that the government runs where healthcare is involved, for example, Medicaid and Medicare. Since 1964, it was meant to fight poverty and to make people more independent and give them an opportunity to have the American dream. Yet, when it was implemented, 19% of people were under the poverty line. And today, after trillions of dollars spent, hundreds of programs over decades, it has gone down to 16%. So we see it not working. The intentions are there. The intentions are to give people coverage and to make them more independent, but the actual solution and the product of these programs is the exact opposite. I think we have to stop focusing on the intentions and start looking at what we're actually getting from these policies.